suffer from a number of comorbidities that left him more vulnerable to the coronavirus as he was undergoing treatment for blood cancer and also early stage Parkinson's disease. The 84-year-old had also previously survived prostate cancer in 2003, and reports are, Dr. Drew, that he was scheduled to get his booster shot this week. This is one of those cases that really makes the case for boosters, right?
I would agree, and really to look at this as a COVID story is really not accurate medical reporting. The fact is he was diagnosed over 3 years ago with multiple myeloma. In his age group, people with myeloma survive a median average of 2 years. He already was above the median. He also had prostate cancer, which is more aggressive in black males. He had Parkinson's disease. He was a fragile patient, and perhaps even the booster itself could have tipped him off the scale here. But you don't live 5 years with myeloma with his age group. Let's be clear. He's a national treasure. We will miss him. Unbelievable person. But the medical reality here is this is about myeloma, not so much about the COVID.
And myeloma, correct me if I'm wrong, it impacts how your immune system responds.
It sure can, and so can the treatments. I mean, we talk all these days about B cells and T cells these days. Well, the B cells are where it gets sick, and it's a cell line that proliferates and becomes cancerous. And yes, for sure, it affects immune function.
And I think, though, that the anti-vaxxers out there will take a look at this and say, you know what, this is why we don't need to get the vaccine. But the breakthrough cases, by far, are so far and few. In LA County, for instance, it's just about 1% of people who have actually contracted COVID despite being fully vaccinated. In terms of the death rate, it's even lower, 0.005%.
Yes, I personally, let me share with you, I don't want this thing again. It's a brute. It's a brutal illness in many people. Not in everybody, but if you're over 65, let's do this. Let's get fully vaccinated.
Yeah, for sure. And as you said, it is such a loss, though. 84 years old, Colin Powell, a trailblazer, without a doubt. So through October the 12th, more than 187 million people in the U.S. now are fully vaccinated, and 1 out of every 26,000 fully vaccinated people has died of COVID-19. That's 0.004%. So even
clear.
Smaller
That's
nationally.
Right. And again, it is the very elderly, the people that have fragile medical condition. Those are the ones that are affected disproportionately by this virus.
All right. Well, speaking of, the Food and Drug Administration is expected to approve mixing and matching vaccine brands for the booster shot. According to the New York Times, the approval could come by Wednesday, when the FDA is expected to authorize both boosters of the Moderna and also the J&J vaccines for those 65 and older and or immunocompromised. Now, this move comes after a study showed recipients of J&J single doses who received a Moderna booster saw their antibody levels rise 76-fold compared with only a 4-fold increase after an extra dose of Johnson & Johnson. So how do you feel about the mixing and matching?
Great news, everybody. I mean, if you have concerns about J&J, and that was the one that had the clotting side effects, though rare, it had that. You now have good evidence, let's face it, it's essentially proof that you can take an mRNA vaccine and actually even have a more significant response than if you just take the J&J vaccine itself. Again, people get a little bit confused. What really was first approved was that J&J is now going to become a 2-dose vaccine like all the other vaccines. But if you've only had one and it's time to get a second one, you're worried that it's not going to be sustained, you can take an mRNA vaccine.
And from what I read, this booster for the J&J, it's just after 2 months.
Correct. So it's not even the booster. It's more like, Pfizer and Moderna are 2 shots. Okay. J&J is really now 2 shots. And there's a lot of people out there that have gone far longer than 2 months, myself included.
Yeah.
And if it's time to get that booster, you have your choice now. If you've been worried about the J&J, you can now go to mRNA, which I think I might do myself. Again, I'm watching because I've had natural immunity and a booster, and a vaccine. I'm watching to see when I get to the point where I need a booster, and I will do that. I'll probably take the mRNA vaccine.
And J&J is can you say least popular? 15 million Americans received it versus 105 million who got Pfizer.
It came out late. It came out late, and it had a problem right away that was not detected until after it got distributed, so people got concerned about it. Still a very good vaccine, let's be fair. It's a good vaccine.
Yeah. Let's be fair, for sure. Okay, let's talk about those demonstrations against those school vaccine mandates all across the state today. Sky Fox capturing these images over Birmingham Community High School in Van Nuys, where a crowd of parents and teachers marched against the mandate to vaccinate all students who are eligible for COVID-19. Many parents say there simply has not been enough research on how that vaccine will affect children.
It's not right to mandate it. It's a risk. It's a big risk. Honestly, I think it's more of a risk than COVID-19 is to this age group.
Yeah, that vaccine mandate also impacts teachers and staff of schools statewide. Health officials emphasize that the Pfizer vaccine has been approved for children as young as 12. They say the benefits of the vaccine outweigh the risks. Now, two women who took part in the sit-out are founding members of a grassroots movement called Moms on the Ground. Laura Sextro and Parisa Fishback. They join us now live. Thank you, ladies, so much for being with us. Parisa, I'm going to start with you. Explain your stance overall.
Overall, very simple. We are strictly and narrowly in protest of the proposed vaccine mandate as it applies to school-age children.
Okay, plain and simple. Laura, you say that this is not necessarily a group of anti-vaxxers, correct?
That's correct. In fact, much to Parisa's point, the group of Moms on the Ground was really formed through really a broad spectrum of parents, from whether it be from political views to how we view vaccines. We were very clear kind of going into this, that this had nothing to do with politics and had nothing to do with the fact that there are certain people that are anti-vax. We are not anti-vax. This really lies squarely in the concept of usurping parents' rights and a government overreach in terms of the mandate itself.
Yeah, and my concern is, we need to stop the replication of this virus. We all agree that if this thing goes unchecked, there's lots of replication, there's lots of horrible variants in our future. If not a mandate, what do you suggest we do?
I think that we can instill the protocols that we have in place right now. We have health protocols that seemingly have proven to be effective. From January until about June in California, we saw a significant drop and a steady drop in the COVID-19 cases. And at that point, we were primarily using the social distancing, the masking, and the COVID screening. The general public at that point was not receiving the vaccine, and that worked. And it's definitely less intrusive. So the proposition from us is, why not maintain those health protocols until we come to a point where we are no longer calling this a state of emergency, or until we've had more time to experience some more testing with regard to how this vaccine is affecting children.
Well, Parisa, it has changed over the course of the pandemic in terms of the virus. We had the Delta variant, which was so much more contagious. And I know that this is certainly a tough decision to make as a parent. We certainly understand the concern. Laura, when speaking to you, you mentioned that there just weren't enough long-term studies. So how do you overcome that?
Yeah, I mean, I agree. I still think that there's not enough longitudinal studies to really feel secure about this as parents. But that being said, I also think that we can all probably acknowledge what the CDC, the World Health, the NIH have all indicated, which is this is a virus that has very low impact to the pediatric community, pediatric being defined as 0 to 18.
But it's the collective responsibility, right? So it's not, certainly kids, Dr. Drew, and let's hear from you.
So the incidence of myocarditis, which is an inflammation of the heart that has been documented in younger males from the vaccine, is about 1 in 6,800 doses. So not doses, but actually vaccinated individuals. So it's about 1 in 7,000. That's the risk. And the vast majority of that is mild. All of it essentially has been reversible in a very short period of time. One child was documented to have gotten rather sick from this, but that's a pretty rare outcome. And the risk of not doing it is that, again, kids, maybe Parisa, that doesn't work, kids get infected, there are outbreaks, there's more viral load in the community, and that's the downside, really. So it's something, I get this is a tough decision. Marla mentioned this to you guys. I get it is tough. Are you able to sit with your physicians, your pediatricians, and make these decisions? Have you talked to your doctors yet?
Absolutely.
Go ahead, Laura.
Sorry. Yeah, absolutely. I think that's actually at the heart of what we encourage, is that every parent should, in fact, work with their respective medical professionals to make informed decisions. But at the end of the day, it really should lie in the hands of the parents. And we've had a lot of conversations as a board to discuss the impact to the community. And I know we've also gotten a lot of feedback from people saying that children, even though it presents fairly low risk for them, then how do we protect the older, maybe at-risk populations? And we firmly believe that are we a society where we would use a demographic that is fairly low risk to shield adults in society, for lack of a better term? And I don't think that we're a society that wants to use our children as a first line of defense.
Dr. Drew, the concern there from Laura there, and I'm sure Parisa feels the same way about the lack of long-term studies.
Yeah.
Reaction to that.
I mean, I'm sympathetic. I understand we're in kind of an extraordinary situation here. I remember my own kids when the chickenpox vaccine came out. I wanted to see a little more time under my belt. They got chickenpox in the meantime. I was wrong to have done that. The vaccine turned out to be totally safe. I think the reality is we do have a lot of data. I think you can rely on the FDA doing a good job of reviewing this. So the risk of the vaccine itself may be very, very small.
Parisa, your reaction?
The risk of COVID-19 is also very, very small. I think the last time we checked was October 19th, and CDC reported 0 to 19 years of age, the risk of severe injury, or let's say death, is 0.00003. I don't see it being warranted to vaccinate our children, and that's the national level, let alone what it is in California, which is far less. It's a matter of vaccines being warranted, not just looking at the potential risk that they're exposed to, as Dr. Drew had stated, myocarditis and also severe blood clotting. We're not sure also how rare is that actually, because we are just starting to vaccinate the 12 and up community. So is it possible that we're going to see more side effects like that? Or are we going to see more occurrences of those side effects? I would like to wait and see for that purpose, but it doesn't change the purview that at this point, it is not warranted to vaccinate our children for the sake of our children. And to Laura's point, if we're having a discussion about vaccinating children for the protection of the rest of the adult community, that becomes a moral issue in my mind.
The only thing I push back on is really not about shielding the older people. It's about preventing some terrible variant that will become destructive to all of us, including children. That could be our future if we're not careful.
So, Dr. Drew, you do certainly suggest getting the vaccine.
I suggest you sit with your medical provider and you guys make that decision together. I'm a big believer in patients and doctors together making the decisions, and they're going to have to stay in school. So.
Yep. Okay, Laura and Parisa, we thank you so much for being with us tonight, co-founders of Moms on the Ground. Thank you, ladies.
Thank you for having us.
All right, still to come, LA County wants Vanessa Bryant to take a psychiatric exam. They want to determine if she truly suffers